There are currently 4.6 million stroke survivors in the United States, and stroke is the leading cause of adult disability. Approximately 20% of patients in nursing homes have had a stroke. And stroke is also a leading diagnosis in inpatient rehabilitation. Owing in part to the need for these expensive post-hospitalization care environments, stroke is also one of the most expensive diseases in the United States, with annual costs greater than $50 billion. Current projections are that death caused by stroke will increase exponentially in the next 30 years, owing to aging of the population and our inability to control risk factors. Stroke risk is increased above that of the general population in elderly male individuals and in African Americans. In addition, geographic disparity in stroke incidence exists, such that several areas of the southeastern United States have stroke mortality rates more than twice that of the national average. This phenomenon, originally describing areas of the coastal Carolinas and Georgia, has been named the stroke belt. Etiology: stroke can be either ischemic or hemorrhagic. 88% and 12% respectively of all strokes in the 2006 American Heart Association report. Point 1. A classification of stroke by mechanism is given in Fig. 22.1. Hemorrhagic strokes include subarachnoid hemorrhage, intracerebral hemorrhage, and subdural hematomas. Subarachnoid hemorrhage occurs when blood enters the subarachnoid space, where cerebrospinal fluid is housed, owing to either trauma, rupture of an intracranial aneurysm, or rupture of an arteriovenous malformation, AVM. By contrast, intracerebral hemorrhage occurs when a blood vessel ruptures within the brain parenchyma itself, resulting in the formation of a hematoma. These types of hemorrhages very often are associated with uncontrolled high blood pressure and sometimes antithrombotic or thrombolytic therapy. Subdural hematomas refer to collections of blood below the dura, covering of the brain, and they are caused most often by trauma. Hemorrhagic stroke, although less common, is significantly more lethal than ischemic stroke, with 30-day case fatality rates that are 2 to 6 times higher. 6 ischemic strokes are caused either by local thrombus formation or by embolic phenomenon, resulting in occlusion of a cerebral artery. Atherosclerosis, particularly of the cerebral vasculature, is a causative factor in most cases of ischemic stroke, although 30% are cryptogenic. Emboli can arise either from intra- or extracranial arteries, including the aortic arch, or, as is the case in 20% of all ischemic strokes, the heart. Cardiogenic embolism is presumed to have occurred if the patient has concomitant atrial fibrillation, valvular heart disease, or any other condition of the heart that can lead to clot formation. 7. Distinguishing between cardiogenic embolism and other causes of ischemic stroke is important in determining long-term pharmacotherapy in a given patient. Risk factors. Risk factors for stroke can be subdivided into non-modifiable, modifiable, and potentially modifiable. In addition, risk factors can be either well-documented or less well-documented. 8. The main risk factors of stroke are listed in Table 22.1. Recommendations for risk factor reduction aggressively target the modifiable, well-documented risk factors, even in individuals with non-modifiable risk. 8. The non-modifiable risk factors are age, race, sex, low birth weight, and family history. An individual's risk of having a stroke increases substantially as he or she ages, with a doubling of risk for each decade older than 55 years of age. African Americans, Asian Pacific Islanders, and Hispanics experience higher death rates than their Caucasian counterparts. 1. 4 men are at a higher risk of stroke than women when matched for age, but women who suffer from a stroke are more likely to die from it. 1. The most common modifiable, well-documented risk factors for stroke include hypertension, cigarette smoking, diabetes, atrial fibrillation, and dyslipidemia. The treatment of hypertension, beginning in the mid-20th century, is thought to be primarily responsible for the drastic reduction in stroke death rates between 1950 and 1980 in the United States. 4. A second very important risk factor for stroke is cardiac disease. Patients with coronary artery disease, congestive heart failure, left ventricular hypertrophy, and especially atrial fibrillation are at increased risk of stroke. 8. 9. In fact, the presence of atrial fibrillation is one of the most potent risk factors for ischemic stroke, with stroke rates from 5% to 20% per year depending on the patient's comorbid conditions. 10. 11. Other known risk factors for atherosclerosis are also known to place patients at risk of stroke. Diabetes mellitus, dyslipidemia, and cigarette smoking are known atherogenic states that lead to cerebrovascular disease and ischemic stroke.